Okay, let's dive right in. You've got this medical case study assignment and you want to nail it, right? Well, in the next few minutes, we are going to crack the code on this thing. We'll break down every single piece so you know exactly what to do to get a great grade. Because that's really the big question, isn't it? This isn't just some dry, technical paper. It's your chance to take all those new, complex terms you've been learning and actually weave them into a story. It's about being precise, but also a little bit creative. So, how do we do that? Here's our game plan. First, we'll talk about the why, the mission's purpose. Then we'll get into the nitty-gritty of writing the case study itself and adding those essential components. After that, we are going to decode the grading rubric, so you know exactly where your points come from. And finally, we'll cover the official policy on using AI the right way. Let's jump in. All right, first things first. Why are you even doing this? I know it's easy to look at an assignment like this and just see it as, busy work. But I promise you, it's so much more than that. It's about learning to speak the language of medicine like a true professional. And this quote right here, it just nails it. You spent weeks learning all the little pieces, the roots, the prefixes, the suffixes. Those are the building blocks. This assignment is where you put them all together to build something real, to show you can use that language correctly in a practical context. And this is the core skill we're building. I mean, think about it. Whether you're writing up patient notes or explaining a diagnosis to a colleague, being clear and precise is everything. It's non-negotiable. This assignment, it's your training ground for that. Okay, so we've covered the why. Now let's shift gears to the what. What exactly do you need to write? Let's break down the core pieces of your medical story. So here's the main task, plain and simple, 2 pages, double-spaced. And notice that word fictional. This is key. You get to be creative. You can invent a patient, human or animal, and build a whole case from scratch. You get to play both medical detective and storyteller. You know, every good story has a beginning, a middle, and an end. Well, your case study is no different. You're going to start with the present problem. What are the symptoms? Then you'll look to the past. What's the patient's history? And finally, you propose a path for the future, the treatment plan. Just follow those 3 steps, and you've got yourself a solid structure. Now, that 2-page story is the heart of it all, but it's not the whole thing. You've got a few crucial details to add at the end to really complete the paper. So let's talk about what those are. Okay, I want you to burn this number into your brain. 15. This is your magic number. It is the absolute minimum number of medical terms from class that you have to use in your case study. Not 14, at least 15. And after your story is done, you're going to add a glossary. This is where you define those 15 plus terms you used. It shows you not only know how to use the words, but you know what they mean. And just a quick note on the bibliography, you only need to include one if you go looking for outside sources. If you stick to our course texts, you don't have to worry about it. All right, let's talk strategy. Knowing exactly how you're graded is basically like getting a cheat sheet for success. This whole assignment is worth 40 points, and I'm going to show you exactly how they break down. This table lays it all out, and just look at where the points are. Using your terminology correctly in the story, that's 20 points. 20. Then, getting the format right, the symptoms, history, and treatment, that's 10 points. And the glossary is the final 10. So it's pretty obvious where you need to focus most of your energy, right? And if that wasn't clear enough, this chart just screams it. A full 50%, half of your entire grade, comes down to how well you use those 15 plus medical terms inside your story. This is, without a doubt, the single most important part of the entire assignment. Okay, time to talk about the elephant in the room, AI. Can you use it? The short answer is yes. But, and this is a really big but, there are very specific rules you absolutely have to follow. The policy is actually super simple. You can absolutely use AI as a thinking partner. Use it to brainstorm ideas for diseases or symptoms. Use it to help with research. What you cannot do is ask it to write the paper for you. The final work, the actual words on the page, they have to be 100% yours. And this bit is so important, so please listen closely. If you use an AI tool to help you prepare, you have to cite it, and you have to attach a transcript of your conversation. You treat it just like any other source. Being transparent is what matters here. Don't skip this step. So let's do a lightning round recap. We're talking 2 pages, a story with 3 core parts: symptoms, history, treatment, a glossary with at least 15 terms, and the whole shebang is worth 40 points, with half of them writing on how you use that terminology. Got it? Good. And now, the fun begins. The assignment is clear. The rubric is totally decoded. The only thing left to do is for you to put on that lab coat and your writer's cap. So the only question left is, what medical mystery are you going to create? I seriously can't wait to see what you come up with.